Hi, welcome back to the podcast. I have here again special guest Lauren, your hygiene coach, and my sister, who's going to answer a very important question that we're getting from dental offices on how do we set up recare appointments. Lauren,
Hel-
go for it.
Yes. Hello, Ashley. Thank you again for having me on the podcast. I think this is one of the most important aspects of your dental appointment because, as we know, cancellations can be a huge issue in offices. So, setting up your recare ahead of time before they leave the office is essential. I would say I'm a huge believer in always pre appointing my appointments. Typically, I like to pre-appoint at least 98% of my patients. It is rare that I let a patient leave without an appointment, but occasionally I will for select patients that don't really respect the time kind of our office. Um, One thing I do tell people is scheduling just to schedule, though, is not the best approach. Using these few tips can help reduce the time spent on the phone and reduce the days that you come in and the schedule's wide open. Firstly, this is really important. I do not let the patients decide where to schedule unless they've made it very clear that they can only go with one time of the day, one certain day. I give them guidance based upon the needs of our office. I always keep in mind evening and mornings are easier to fill. Okay, so my goal is hours between 10 a.m. and 2 p.m. I know those are typically my hardest time slots to fill. So, any patient that is retired or doesn't need evenings or mornings, I'll use them to kind of fill in my easier slots. But actively listening to your patients and notes and cues of, oh, I'm retired. Okay, ding, that's going to be a 10 a.m. patient. So you really have to use your appointment to really listen to your patients. Um, Secondly, I believe scheduling based upon production is the best approach. I check a patient's insurance frequency. I see if it's 2 times per year or once every 6 months. And I personally schedule based upon my production on different days. If the frequency is not an issue, I will schedule up even 2 weeks prior to their quote, due date, because I know that, some days you were out of town the week before. So 6 months from there, you're not going to have anybody. So if you stick to a very strict, okay, 6 months in one day, you're not going to have the ability to fill in those days where, it didn't work for this person's schedule, or we were out of town. We have this whole week that nobody's on there. So really looking at your production is where you should place your patients. The last thing I would say is it's all about direction. For the most part, I think also patients will appreciate direction. They've just been possibly told something's going on in their mouth. We typically talk a lot in our appointment. The last thing I think they want to do is spend a 2-minute conversation on where to schedule, be given all of these different dates, times, all that kind of stuff. In all reality, give them the direction. I think they really appreciate it more. I keep this part simple, but I always make sure to ask for a commitment. So I like to give an example. This is typically what I would say to a patient at the end of the appointment. Debbie, 6 months from now, will put us in January for your next reservation with me. I have Wednesday the 6th at 10 or Thursday the 14th at 11. Which works best for your schedule? And then, of course, she'd choose one of those if it was just, great way of saying it. And then I will make sure to say, now, Debbie, you will get a reminder a month before this appointment. Will you help me out and make sure to reach out as soon as you get your reminder if there is a conflict? This part is crucial because getting a commitment by asking, will you, helps the patient see value in their next reservation. Typically, if a patient just hears, okay, it's going to be this time, but actually asking for a commitment is going to be a game changer. So these small tips, I think, make scheduling as productive as possible. It reduces the time, the lovely ladies up front have to spend tracking down the patients, because the one thing we all know is once they leave that door, that is a very difficult job. Nobody wants to answer their phone, and it's very hard to get them to schedule. So having them leave with that commitment is really key to success.
Those are definitely some great tips. I know just that little script at the end will definitely get your patients to schedule. So thank you so much for that. And if you have not checked it out, please go to the website at bonddentalconsulting.com/mini course, where you can see Lauren's new mini course on mastering your intraoral camera. You will not want to miss that. So go check that out. Lauren, thank you so much for joining us again. And this has been Quick Bites for your dental office. I'm Ashley Bond. Tune in next time to get all your dental questions answered. Thank you so much.